to it. Oh, yes, perfect. Thank you, Joy. Um, and we're going to be talking probably also a little bit too about maybe what some of this election might mean for some of this work and this rule and everything we're kind of talking about today. My name is Nick Large. I'm with an organization called Homebase. I'm joined here by my colleague Joy. And so Homebase is an organization. We're based in San Francisco. I'm coming to you live from the SOMA in San Francisco right now, but we do trainings with communities a lot in the Bay Area, California, but also nationally. We work with communities to address homelessness and whatever that means in that community. So that can be trainings, it can be, helping people out with project applications, helping people make sure they have all the right policies HUD says they're supposed to have, kind of reviewing client files, making sure documentation is, all lining up and what's supposed to be there. We do a whole variety of things. But today we're going to be doing a training with all of you. And so I'm glad that you all were able to make it today, especially after a big election yesterday. And I'm glad to be with all of you. Yeah, you want to introduce yourself? You want to say anything, Joy?
Hey everyone, Joy here, also from Homebase. And I'm really excited to be doing this training. I think we've done it in a few communities and also in San Mateo before. So excited to be able to share this out again and see you all today.
Great. And so what we are going to be chatting about today, we did our little welcome. We also have an introduction that's going to come from one of the HSA staff. After that, we're going to cover some foundational language. We're going to talk about terminology, including what you all will be, or what you all see in your HMIS system, right? What those different options are, what they mean, when to select them, how many you can select, all of that. We'll be talking about the actual equal access rule, right? So that's the HUD rule that applies to all CPD programs. So what that means is if maybe you have a PSH site, maybe you have a rapid rehousing project, even maybe if you're a shelter, it could be likely that you get some of that type of funding, and that means the equal access rule would apply to you. We'll also be talking about a concept called family separation. So that's something that's also kind of related to the equal access rule and how families are defined, what a household is. After that, we will have Matthew talk a little bit about a recent kind of survey that was done, sharing out some of those results and what they're finding. Then we have some breakout scenarios that we're going to be working with on all of you. We're going to do some breakout rooms, hopefully by role. And we'll be kind of bouncing in and out of those, helping you work through them. And then we will be kind of coming back together for our closing thoughts and our group discussion. So with that, I'm going to pass it off to our San Mateo HSE. I'm going to stop sharing this to give our introduction here.
Good afternoon, everyone. I'm Kalia Parrish with the County Human Services Agency. And our agency Center on Homelessness works alongside your agencies as a funder through county contracts, and we play a role in implementing the county's continuum of care and the county's strategic plan on homelessness. So I just want to start off today by thanking you all for attending and for all the difficult work you do for community members experiencing homelessness. I know you're extremely busy and it's always tough to get away for a training. So thanks for being here today, and thanks to your agencies for supporting you with being here today. One of the things that we do in our role is work with your agencies to ensure that our community is welcoming and accessible to all clients in need of services, and to ensure that we are also in compliance with applicable federal and state guidelines on services. And so this training's content is an important part of both of those aspects. So again, thanks to being here today, and thanks to Homebase for facilitating this training. Pass it back to Homebase.
Awesome, thank you. Okay, well, with that being said, let's get started here. And so kind of going into our first topic here, and what we'll first be talking about is some foundational language and terminology. And so we're going to start that off with this fun little diagram. So some of you might have already seen this before. Some of you might have seen something very similar. I know there's a gingerbread, person, one that also goes around, looks very similar. But I think this kind of infographic is a really good explainer to get us talking about a lot of the terminology and a lot of the concepts that we'll be talking about, right, with equal access. So here we go. This is the gender unicorn. It comes from the Trans Student, what is it, Educational Resource Center. I forget what their name is. But it defines and kind of shows some of the key identities and key terms that we'll need, right? And so there's this little visual diagram here. You can see gender identity is here at the top. And so we have that little rainbow. It's the gender identity. You have it coming out of the mind or the brain of the unicorn, if you will. And so when we're talking about gender identity, we're talking about someone's internal kind of sense of gender and how they identify, right? And as we talk about equal access, when we talk about gender in HMIS, those are the same thing, right? Gender is self-reported. Gender is someone's deeply held sense, kind of belief of gender, right? And here on the right of the unicorn, right, we have all of these lines or these kind of continuums, right? Kind of showing that how people identify their gender might be different, right? Or it might be kind of in this continuum, if you will, right? You'll have people who will identify as man, you'll have people who will identify as a woman, and you'll have a whole other kind of variety of identities within that and kind of outside of that, right? And you see some of those reflected when you look in your client profiles, right? Or when you're selecting some of those options. When we talk about gender expression, right, you can see we have these little green dots here that are around the unicorn. And so gender expression, typically we think of that as the observable, manifestations of gender, right? The observable characteristics, like what can you observe about someone's gender or how it's expressed, right? And so that can be something like clothing, right? Clothing can have connotations of gender. That can be something like hair, maybe even something like color or like a name or body language, all different things that have connotations of gender, right? That's an expression of gender. And so when we think about gender expression too, I think it's important for us to also remember that things that maybe have a masculine connotation or a feminine connotation, that varies culturally, right? Like in some places, if you're wearing a skirt, maybe it's a very feminine thing. In other places, if you're wearing a skirt, maybe that's a very masculine thing. And these different connotations we have of gender are also things that change over time, right? And so my favorite example of this that I like talking about is like high heels, right? Like now we think of high heels and we think of stilettos as being like very feminine, right? But if you go back through history, through some purposes where high heels were first developed, it was to keep someone's foot in like a horse stirrup, right? And so it was actually a very masculine expression of gender because the people who wore heels were going into battle, right? It wasn't kind of like, oh, I'm wearing my stilettos and I'm like going out on the town kind of thing. It was a very different purpose. Let's see. And when we talk about sex assigned at birth, right? So oftentimes you'll hear people talk about sex. Sometimes people will use gender and sex interchangeably, right? I think maybe that's something you see a lot in the news or you see something like that related in the media. But sex can be defined in a lot of ways. And I think typically, when we think of sex, we think of the biological aspects related to it, right? And so, I think especially in the recent Olympics, right, we had a lot of discussions about that were in the news, like, oh, this person is a man or this person is a woman. And no one really seemed to have a definition of that or an agreement on that, right? And like biologically and from a biological perspective, sex can be defined in a lot of different ways, right? It can be someone's chromosomes. Some people will talk about it as hormone levels. Some people will talk about it as like, physical aspects, right? Like, do I have this? Do I have this? Do I not have this? Right? And so sex will be defined in a lot of different ways. And a lot of different aspects kind of go into the creation of that, if you will. When we talk about sex assigned at birth, so sex assigned at birth is maybe in a way kind of self-explanatory, right? It's the sex that, typically a doctor will assign someone at birth. And typically that's based on kind of an observable sex characteristic. So typically that will be based on like an individual's genitals at birth, right? That's how sex assigned at birth is generally defined or generally used. And when we get down to here to these other kind of options or these other kind of continuums on this unicorn, right? We have attraction, right? So we think of this, maybe as like sexual orientation, right? So maybe who is someone attracted to and how is someone attracted to them, right? So common, sexual orientations, right? You're hearing gay, you're hearing bisexual, pansexual, queer, all of these different types of sexual orientations, these different types of identities. And you can have people who are attracted to certain aspects of that, right? People may have a physical attraction. They may be able to develop emotional relationships with different genders or with different people, right? So a lot of kind of variation within that. And I'm going to pause here if anyone has questions, because I just threw like a million years of, gender and sexual theory at you. So I'm going to pause here. Does anyone have questions about any of that? Does all of that make sense? Anything you feel like you don't understand? Okay. And so one thing I wanted to go over to is, how does all of what I just said, right, relate to some of what you see within HMIS? So recently HUD updated their HMIS, they have standards, right? They call them their HMIS data standards. Their 2024 standards introduced a lot of new options. So race and gender, when you're in your client profiles, you're probably seeing some new things, right? You're noticing some new options there. And for gender, they updated a few things and also how we kind of collect those, right? Um, so when we think about gender, when you're putting it in the client profile, maybe you're doing intake or something like that, the gender does not have to match legal documents, and clients, they're not supposed to be asked about like their medical history, like, oh, did you transition, or are you taking hormones, or do you have XYZ? It's self-reported, right? So when you think, right, also about a lot of those other, options that you're putting in the client profile, same thing, self-reported, right? And this is a part of the equal access rule as well. And it's distinctly different from sex assigned at birth, right? So gender is self-reported, self-identification. When you look in HMI, so when you look at those different gender options too, right? Some of them you can select multiple versions. You can select multiple options, but some are exclusive, and we'll talk about that. I'll kind of show the different options in a sec. And an important thing to remember, because I think for San Mateo, I believe all of you have like an open HMI system, which means that you can see maybe client records or other clients from other programs, perhaps. And so, right, if that's the case, you may be working with someone who maybe they're reporting a gender that's different than what you see in their client record, right? Maybe it's new. Maybe it's something that they're coming into their identity about. And so as you're talking with your clients and working with them and on inputting all of this information, maybe updating their client profile, right? You'll want to talk with them and say, hey, I noticed this is what's showing in your record. But this is what you're telling me. Do you want me to switch it to this? Is it okay if other programs see that you're enrolled in? You'll want to have that type of conversation. And so what are the options that you see, right? So you'll have woman, man, culturally specific identity, different identity, right? These are some of the options. I would note that the woman and man option, those aren't like mutually, they're not, if you select those, you can select other options as well, right? So for example, there's like a transgender option, right? So a client could have, or you could in their client profile, right, select someone is both transgender and a woman, transgender and a man, right? One of the big updates too with the 2024 data standards is there's now an option for culturally specific identities, right? And so these are gender identities that are tied to like, specific cultures. And I have some examples I'll show you And so maybe, you know, as you're working with clients, you might see some of these, or they might kind of talk about it or reference it. And so then you'll know, okay, they're saying this is one of the culturally specific identities. There's also an option in HMIS for different identity, right? So if someone, you know, you go through these options, you say, hey, these are the options that we have. Which one, you know, do you identify with one of these? Does one of these work for you? Maybe they'll say no. Maybe they'll say, oh, I, you know, identify this way. You can select different identity and then you can write in that option essentially. Other things you'll see transgender, non-binary, and questioning, right? So transgender is another one of these options that's not, you know, an exclusive one. You can select other ones. And when you're looking at questioning, right, I think sometimes maybe the questioning kind of identity or the questioning option can get confused with like client doesn't know or client prefers not to answer, right? But when you're looking at questioning, the important thing to think about or kind of remember when you're, you know, thinking if you should select this option, it's about, is the client, you know, exploring their gender identity? Are they maybe like, oh, maybe it was this, but I'm not, no, you know, I don't know right now, or I'm thinking maybe this, but I'm not quite sure. Like that's the questioning. So if you're having a conversation with a client, you know, and that's how the conversation is going, right? Then questioning might be the option you want to select. Client doesn't know, right, is going to be pretty different. And so client doesn't know is like, okay, you read the entire list of options to them, you know, they say out of those, they really maybe aren't comfortable or they really have no idea, right? And this is not they have a different identity that they're identifying with. They just kind of don't know out of the option, and you continuing that conversation is kind of going nowhere, right? And then when you have client prefers not to answer, right? That is when you're having a conversation with someone, right? And they're explicitly telling you maybe they don't want this inputted. Any questions about any of that? Okay. Okay, so something I wanted to also include in here, right? Since now we have like culturally specific identities as an option that you'll see within HMIS, is some examples of those, right? And so, you know, maybe in kind of like our Western centric world, we think of gender, you know, more as being a strict binary. We think of men, we think of women. But if we look throughout the world, if we look throughout history, there are so many examples of things that are outside of that, right? We can look to like ancient medical texts in India from like, you know, 1000 BC that had like 7 genders. And we can look, you know, across the world today, not even historically, but just today, like what's happening in other countries, right? I recently watched this like Netflix show. What was it called? It was El Secreto del Rio. So it was like the secret of the river. And it was a really interesting kind of like short series. But it talked about this third gender in I guess primarily Oaxaca, Mexico, called Mushe. So it was a really interesting kind of mini series. If you have Netflix, it's pretty cool to check out. But one of these examples of culturally specific identities, right? Other kinds of cultural identities, right? You have some Pacific Islander cultures that have, you know, maybe third or fourth identities, other kind of indigenous South American cultural identities, right? So in Samoa, right, there's the Fa'afa'ine and Fa'afatama, third and fourth genders that kind of move between male and female worlds. Maichi in southern Chile, right? Another kind of gender that I think that's kind of interesting because it's also tied to this aspect of like spirituality. But just some examples here. Okay, and so now I'm going to pass it to my colleague here, Joy, and we are going to get into the actual equal access rule.
Thanks, Nick. I think we can go to the next slide. So I just wanted to provide an overview of the equal access rule first and sort of how it came into existence. So in September 2016, the Department of Housing and Urban Development published the equal access in accordance with an individual's gender identity in community planning and development programs. So it's more commonly referred to as the equal access final rule. And it was actually an update on a previous rule created in 2012, and it includes updated guidance on the treatment of transgender people. And also wanted to just say that it's a series of regulations from HUD that are meant to ensure and protect these equal access to HUD assisted housing and programs. So mainly it's meant to prohibit discrimination on the basis of sexual orientation, gender identity, or marital status. And it also defines some key terms, so sexual orientation, gender identity, and it also expands the definition of family or households. It also prohibits intrusive questioning or inquiry about an applicant's sexual orientation or gender identity. And if we go to the next slide, yeah, we just wanted to highlight some important points of the rule. So mainly that it's required for all community planning and development or CPD programs. It provides that individuals are placed in accordance with their gender identity, regardless of their gender expression or perceived gender. There are no requirements for individuals to have to prove their gender identity, and providers must update policies and procedures to reflect requirements. After this training and towards the end, we're going to share a link to a folder with some resources in it for you, and there will be more information around that point there as well. Next slide. So going into why equal access is important. Namely, we wanted to call out trans and gender nonconforming folks are experiencing some of the highest rates of homelessness of any population. And we wanted to pull out some key points from the 2022 US Transgender Survey. So this was a community-based survey fielded from October to December of 2022, and essentially gathered information on the experiences of trans and non-binary people in the United States. So it covered things like healthcare, housing, safety, education, and we just wanted to share these highlights to reinforce why equal access is important and why it's necessary to be providing services appropriately and making sure that access is there, especially for trans folks and gender fluid people. So some of these highlights include that 48% of folks who saw a healthcare provider in the last 12 months reported at least one negative experience. 30% had experienced homelessness in their lifetime. 9% reported that they were denied equal treatment or services in the last 12 months because of their gender identity or expression. And folks experiencing homelessness are disproportionately LGBTQ+, especially in the youth population. So we see, even though there are like protections in place, discrimination is still happening. And so we really want to be paying attention to providing access and appropriate services to folks, anyone that comes to our services and our systems of care. Nick, did you want to chime in on anything about the rule here?
Yeah, I know like maybe after the election yesterday, people have like a lot of questions on what's going to happen to the rule or what's going to kind of happen to maybe HUD or any of the policies or anything that come out of that, right? And so for equal access, some of you may remember that when Ben Carson was kind of, the head of HUD during the Trump administration, they kind of tried to repeal the rule, but since then, right, the rule has been finalized. So one thing about HUD and how they operate is that HUD has a very kind of thorough approval process and process for public comment, right? So when a change and a big change, when a rule is going to be made through HUD, right, they have to go through this entire public process. And that's not something that that's quick. And so typically that's not something that one administration like within their own can change. And so if you're wondering like, oh, what's going to happen to this rule, right? You can remember that previously, one of the administrations, right, tried to repeal it, but that is not something that was able to happen within a 4-year period. And even, if we consider, oh, if equal access gets struck down in some other way, you're all in San Mateo County, you're all within California. California has, anti-discrimination policies of its own, anti-discrimination regulations of its own. If you all get funding, through some of the different California housing departments, essentially the same thing is going to apply to you, whether or not equal access, exists at a federal level. San Mateo, I imagine, also has similar types of protections in place. A lot of the California counties do. Maybe there's even something, at a city level. And so, I think for all of you maybe wondering what's going to happen to this rule, right, in the future, like those are things that are going to be consistent regardless of what happens in a federal administration. So I just wanted to add that, if anyone has any questions about like what, the election means, potential things that can happen, I'm open to trying to answer those for you. I can't promise that I'll have all the answers right, but I can try and answer them to the best of my ability. But yeah, well, maybe we'll finish kind of this equal access portion. If anyone has questions on it, then we'll try and answer them, and then we'll kind of move on a little bit.
Well, thanks, Nick. Yeah, and I think we just wanted to focus maybe on an area that we hear a lot in these trainings in other communities, and that's like where the equal access rule would come into play is rules regarding facilities with any shared sleeping or bathing areas. So we really want to take measures that don't impact the individual's access or experience of the program. And providers, as we see on the slide, must take any non-discriminatory steps that might be necessary and appropriate to address privacy concerns raised by residents or occupants. And we want to make sure that these reactions or actions aren't to isolate the person or segregate them, but rather to change the space itself. So we also want to keep in mind placements being made based on an individual's gender identity, and also facility admissions, occupancy, and operating policies must be updated to ensure compliance. So whatever you're doing in practice, and yeah, that must be written down in the policies. So like just to provide an example, let's say a trans man comes up to you and says that he feels uncomfortable showering in a congregate bathroom that has no stalls or curtains. So the appropriate response there would not be to force him to shower at a different time than anyone else. Rather, we would want to make changes to the showering area in general for everyone to ensure greater privacy. We could also think about like if there's men's and women's bathrooms and a single stall bathroom present at the facility, and a client comes to you saying that they're uncomfortable with the bathrooms. We can ask why and investigate that a little bit, and figure out what would make them feel comfortable and give them options, which can include but shouldn't be limited to using the single stall bathroom or using the bathrooms at a different time. So of course, situation by situation, but we want to always make sure that we're making changes to privacy for the comfort of everyone, and also not trying to be segregating anyone from like main community spaces or necessary resources or anything like that. Nick, was there anything else to add here?
Yeah, I think so in the public box folder, we're going to be sharing with you all after this. HUD actually has an equal access. They have a little like Excel self-assessment, kind of like a checklist scenario type of thing. And so they have all of these different examples of, do you have this policy, or how do you, work with, this type of facility, or what's going on here? And they have different examples, they have different recommendations and all of that. And so that will be kind of a good guide if you're wondering, well, I don't understand, like, what policies should I have, or in what ways can, we update things to be supportive of trans and non-binary folks of these different identities, right? there's more details in that. Yeah.
And I think one more note that we wanted to give on the next slide was just understanding the difference between someone's actual gender identity versus perceived gender identity. So we just want to like recognize and honor someone's actual identity and take steps to house and provide services to them in alignment with that. So in terms of like actual gender identity, as we see on the screen, I am a man might be different than the gender or sex listed on someone's ID documents, but those documents should not determine a person's gender identity. We always want to stick with what they are self-identifying as. And then also perceived gender identity. So that kind of goes back to the gender expression, the markers that Nick was talking about before. You seem like a man. So the gender with which someone from the outside can perceive someone to identify with, as opposed to the gender with which they actually identify. So just wanted to call that separation out as well. And I think before we get too much more into the presentation, I'm going to pass it off to Matthew from HSA for a little bit of a report out.
Sure. Thanks, Joy, and thanks, Nicholas. Just wanted to, first of all, I'm Matthew Hayes. I'm a program manager with the Center on Homelessness. So I'm a colleague of Kalia's and Leslie's. Just want to thank Home Base for letting us speak for just a minute or two here. We just have a few slides, but I wanted to just take a minute or two to talk about a project that's been kind of in the works since April. And it's our LGBTQ plus project. I've been working on it, and additionally on this call, Rika Buchholz has been working on it as well, and she's probably on your screen at some point. Just wanted to flag that both of us have been kind of working on it. So I'll be speaking primarily, but Rika, feel free to jump in and add to any pieces that I'm talking about. So as I mentioned, this project started in April. It's a project in partnership with San Mateo County's LGBTQIA plus commission. And in particular, in talking with them and coordinating with them, we wanted to pause and take a look at our homeless response system, which includes our shelter system, our core service agencies, CES, and kind of other services provided as a part of our response system, to look at our system to kind of better understand how we're serving LGBTQ plus population, and to develop some recommendations about how our system and service providers can effectively, and in some cases more effectively, serve the needs of LGBTQ plus residents experiencing homelessness. So this project, as I said, it was initiated in April, and we've been working since that time on various pieces. It's still, strictly speaking, in draft form, but because this training was happening now, we just wanted to kind of take the opportunity to talk a little bit about the project and some of the findings and some of the recommendations we'll be making, or at least moving towards in the future. So for this, just a couple of slides, but for this presentation, I just want to talk about the project methodology, some of our findings, and then some conclusions and next steps. So just a little bit about the methodology. So I think when Marika and I first started tackling this project in April, we started with some data pieces, and just to kind of get a sense for the data around unsheltered LGBTQ plus population in our system. I think what we discovered is that our system, anyway, we don't have a lot of data, so there wasn't a lot to pull from, or a lot of information to gather. So I just, in general, want to flag that most of the methodology for our this project was qualitative in nature. So, and it involved, for example, provider interviews. So we interviewed homeless outreach providers in our system, representatives from different types of all the types of shelter in our system, including adult shelters, family shelters, youth shelters, and our I think that's it, both our congregate and non-congregate adult shelters. We also talked with our core service agency teams, San Mateo County Street Medicine, and our HEAL program. And the idea was we just wanted to get their perspectives on how our system is serving LGBTQ+. Additionally, we interviewed our lived experience advisory group and talked with our COC's Racial Equity Committee, just to, again, try and gather additional information. And then finally, we met with, actually, Marika and I had an opportunity to tour New Haven Inn, which is an inclusive shelter in San Jose that focuses on supporting individuals with who identify as LGBTQ+. So we actually, at least Marika and I, made a field trip as a part of this project, and we were able to see how services are provided in some of our other, in a sister system, neighboring system. So, sorry, next slide, please. So just a little bit, again, super briefly, just a little bit about some of the findings as a result of those interviews and consultations and site visits. So just want to mention, I think overall, during all of those process and all the information we were gathering from everyone, there were really diverse perspectives and diverse responses to our standard set of questions that we would ask the groups. There were some common themes that emerged. So these findings are designed to kind of track those common themes. So here, and again, with the idea that there is some diversity in responses, I'll just kind of go through them one by one and gesture towards what we were able to determine. So the first finding was around data collection. And in general, we found that data collection standards and practices on tracking LGBTQ+ identities in program participants, and including a staff level of comfort in asking questions around data collection. We found that all of that varied widely in our system, so that there were client level data collected at various points in our system, and each agency and each type of program seem to have a slightly different or sometimes very different approach to how they're collecting that data. So that's our first kind of just general finding. Additionally, we had some findings around medical and mental health care. We did identify in our system that there are resources specifically for LGBTQ+ population, including our regular street medicine program, but our street medicine teams will frequently connect folks to our gender clinic. We also found that our homeless outreach teams did a lot of work to connect folks to appropriate resources as well. And at a place like the Navigation Center, where we have healthcare in action on site, they were able to provide some targeted care to the LGBTQ+ community. Additionally, just mental health services, we found that although some mental health resources exist for LGBTQ+ individuals experiencing homelessness, targeted services for this specific population were less available. So we did find that the Pride Center was available to provide some mental health services, but it was more limited throughout our system. Shelter, just want to mention, many of you are shelter providers on this call, but we found that LGBTQ+ population or individuals seeking shelter, especially those who identify as transgender or non-binary, often declined shelter, specifically congregate shelter services or options. And generally that was a result of either past experiences or fear of bullying or harassment. Additionally, just in terms of housing resources, we found that in general, more specialized housing solutions, or we had limited specialized housing solutions for LGBTQ plus. Related to housing, we found that resources for finding employment that's affirming for LGBTQ plus identities was limited, and wraparound support services once individuals became permanently housed was more limited. Finally, just want to mention a little bit about social supports. In general, we found that approaching LGBTQ plus population with respect and showing openness towards their identity was a critical piece to developing rapport with them. And that's throughout our system, our outreach teams, our core service agencies, our shelters, and our permanent housing programs. We found that many individuals who identify were hesitant to identify themselves to service providers, and that specifically there were generational differences in this. So for example, older individuals in this LGBTQ plus population were more hesitant to identify to a provider than younger. So there was some differences in age. Again, that was super high level. There were lots of details around all of those, but I wanted to kind of gesture towards some of the major findings we had. Next slide, please. In general, and I kind of hinted at this as I was going through, but I think there are a couple of pieces that we really want to work towards in our system. I mentioned at the outset that this project and our kind of report out is still in draft form. So the way in which our recommendations going forward will materialize is still to be determined, but I did want to at least point towards the pathways of what we'll be pursuing. One, we'll be looking at opportunities to improve our data collection. I think the more data we can collect in our system about how we're serving LGBTQ plus, the better we'll be able to see gaps and hopefully what we're doing better over time. We think there is an important opportunity to increase, or an important, it's important for us to increase training opportunities. So specifically for all of us and all of our providers, the idea would be that we could use those trainings to create more welcoming environments throughout our system, and to allow our providers to feel more comfortable using respectful language. Additionally, and again, this was kind of across the board and all of our services, we saw a desire and a need for tailored services and service delivery. So for services that are specifically targeted to individuals who identify as LGBTQ plus. So that would be mental health, physical health services, shelter services, permanent housing services, and all of kind of wraparound services that folks need. So kind of looking at opportunities to develop those tailored services is really crucial. And then finally, just wanted to mention as a next step, we are developing a kind of plan and some specificity to kind of these approaches. And we'll be looking at both developing that plan and looking at a timeline for improving for the improvement measures that we're going to identify. So that's more of a heads up. Where hopefully you'll be seeing pieces of this over the next few months and longer, and we'll be continually looking at opportunities to kind of to improve all aspects of our system on this front. So I think that's it on my side. So I'll pass it back to Joy and Nicholas.
Great, thanks.
Yep.
Okay. And so now we are going to get into the family separation portion. And so I'm going to pass it back to Joy here.
Thanks, Nick. Yeah, so we just wanted to go over one of the key parts of equal access, which is defining family. The equal access rule defines family as the following. So it wanted to be really inclusive of potential definitions of family and households. So including but not limited to, regardless of marital status, actual or perceived sexual orientation or gender identity, all of these following things. So essentially, family can be defined as a single person who might be elderly, displaced, near elderly, or any other single person, or family and households can also be defined as a group of people residing together. And it gives some examples as well. So it can be a family with or without children, an elderly family, near elderly family, disabled family, displaced family, or remaining member of a tenant family. So this is just meant to make the definition of family very expansive so that people are, we're not necessarily thinking of family in the terms of like a nuclear unit, right? Like I think this rule provides for a lot more flexibility and really allowing the person who is presenting for services to find who their family is. And to accompany that, we have some highlights and some examples on the next couple of slides. So if we can go to the next slide. Just to get further into like the definition and what this means. So a group of people that present together for assistance and identify themselves as a family, regardless of their actual age or relationship or any other factors, must be served together as a family. Providers would ideally be able to serve every kind of family, regardless of the ages and sexes of the adults and children. And also involuntarily separating families based on the gender of, or age of their minor children is a violation of HUD regulations. So really preventing that family separation and making sure that families are able to stay together, be housed together, and receive services together is really the purpose of defining family under this equal access rule. If we go to the next slide. Some examples here. We wanted to give some things or situations that would be clear violations of the equal access rule in accordance with this family definition. So shelters wouldn't be able to separate teenage boys from their families. Program cannot separate out or deny assistance to adult men that represent as part of a family. So whether that's a father, uncle, mother's boyfriend, etc., if they are presenting as part of the household, and they would be served in accordance with that household. A shelter housing program might limit assistance to households with children, but it may not limit assistance to only with women with children. So if there was a single father with children, they would have to be accepting of that household and that family structure as well. If two adults are presenting together as a family for housing, you must serve the two adults as a family. You can't be asking for any proof of marriage, and you can't limit assistance to couples in a heterosexual relationship either. So really cutting down on any sort of like proof of documentation or any assumptions that you might make of folks that are presenting together for services. And then a housing program cannot reduce the size of a family because one child is in foster care. So these are just kind of examples of places where this family definition and the equal access rule would come into play. And on the next slide, we have some suggestions on how to accommodate families. So for shelter, if the shelter has private rooms in which a family can stay together, then they must be able to stay in a room together if they choose. And also, if the standard practice is to put down mats in a conference room for everyone who's considered overflow or beyond the capacity of the current shelter beds that are open, then it can shelter the family together in that space. And if the standard practice is to place a family in their own room, it would be acceptable to leave a bed empty to accommodate a family. So for example, a family of 4 could stay in a unit with 5 beds, and that 5th bed could be open if they prefer to stay together. And then if the family presents for permanent housing and one child is in foster care, it would be acceptable to house them in a larger unit and document that that's necessary for family reunification. So really preparing for this child in foster care to be reunified with the family and obtaining housing in accordance with that. And as we've said previously, it would you would have to ensure that you have policies and procedures compliant with this rule. And I don't know, Nick, if there's anything else you want to say about these examples.
Yeah, I think when we get into the kind of scenarios portion, so right after this, I'm going to talk a little bit about kind of like a best practices part, so going through maybe some of what you all might be doing in your different roles, then we'll go into kind of scenarios which will, ask you to apply aspects of the equal access rule, ask you to have some of these types of conversations we've been talking about. And then that will also tie into, some of what you see here and some of what Joy's been talking about with different facilities and all of that. Then we'll come back together as a group. So if anyone has kind of questions or is, really wondering, well, I don't have this, or this is the type of facility I have, or like, I don't know how to talk about this, we can, come back together and figure it out. Okay. But the next part here is this best practices part. And so I've broken this up into kind of different phases, if you will, of, first meeting someone, doing outreach, intake, to going into, providing the continual services. And let's see. And I think maybe after this best practices part, we'll do like a 5-minute break too before we go into scenarios. Does it sound good to people? Okay. But kind of starting in this outreach, engagement, and assessment portions, these initial conversations that you have with people, if your outreach, I think we have maybe some outreach folks in here, maybe just generally some people who do intake, or maybe the VI SPDAT assessment or any of that, right? All of these initial conversations that you're going to have with people are going to be very, very important, right? Because this is how you're building your initial rapport with like a client, right? And this is, the initial first time that you talk with them, and that first impression is going to mean so much. And so, when someone is giving you a name, when they're giving you, an identity, when they're telling you, oh, this is, the option that I want, basically go with it, right? Whatever it is whatever it is. And that's, the person's way of testing you, right? And so I used to be a community health outreach worker at like a culturally specific community health center. And so we would do like sexual health kind of questionnaires, STI testing, we used to pass out the free condoms, all of that. We'd go into we'd just be on the street. We had a van. You probably saw us. We would literally go into like sex clubs, bathhouses, all of that. And so we would ask like some hard questions, right? Like if any of you do the VI SPDAT, any of those assessments, those are like hard questions to ask. Like we would ask, also hard questions like, how many people did you have sex with? Right? Like not exactly like the thing that you're excited to talk about with a stranger you just met. And so sometimes when I would be talking to folks, right, especially during that initial assessment, right, I had to be very kind of mindful of how I was asking the questions, what the environment was I was asking them to, right? If we were in kind of an area that had a lot of folks around it, right, that would mean that when I do this kind of initial intake, I'm going to take them around the corner where, they're away from their friends, they're away from the people that they kind of came with. We're going to go around the corner where it's more private. That same thing, that same environment is, I think, going to be very important for any of you who are doing outreach, right? For any of you who are doing those initial assessments. As an outreach worker, as someone doing intake, doing those assessments, some of these like visual cues can be very important too, right? How you approach someone. If you have, even like a little like flag pin can be an important visual indicator that can make someone feel important, or feel seen in a way, right? Like a little rainbow flag, a little trans flag, or something like that. If I was doing certain types of outreach, I would be sure to have certain types of visual cues that I thought would make people feel more comfortable, because when you get someone feeling more comfortable, they're going to give you more accurate answers that's going to be able to help you connect them to services that are going to be more appropriate for them. I would have people who would give me maybe sometimes names that I wasn't sure if it was exactly their name, right? I had I think 2 people who just told me their name was Sparkle, and I was like, okay, your name is Sparkle, go with it. They tell you what their name is and it's something you're not sure if it is, just go with it. Because that conversation that they're having with you is they're testing you. They're testing you to see if you are going to be someone who is safe to share private information with. The same thing is going to be true about gender, their different identities kind of broadly, right? If they give you a certain pronoun, mirror that pronoun. If they use certain language, mirror that language that they're using. And sometimes, right, you may have to explain to someone what some of these different options that you're reading off are. And you may have to talk with them about, hey, I know, and our intake survey, let me tell you, was really long. We had about 1 million different, sexual orientation options, 1 million different gender options, 1 million, racial, ethnic categories. Like it was very long. And so we would get questions, and eventually we had to shorten it because it was just simply too long, right? There were too many options and it was too confusing for people, and that became a barrier. But we would have to explain those options to people. And so some of you, right, as you're doing some of these assessments or explaining what some of these options mean, right, you may have to do something similar. If you're at an agency and you have, an intake that you specially, designed that has all these different identities or things on it, you're probably going to have to revisit what's on your intake form, like somewhat frequently. Like, for example, we used to have under sexual orientation, we had an option for same gender 11, right? That is kind of a sexual orientation type of identity. Um, Used to be historically more common around, with Black folks in the Black community. But we weren't really seeing it anymore. We weren't seeing people identify with that, right? And so that was something that we removed from our intake form. Anything that we weren't seeing anymore in the community, maybe we didn't see anyone who selected it for like a year or 2 years, we took it off our intake form to try and kind of simplify that process. And that's something that will be important for your agencies as well. And all of these intakes, right, and all of these questions you have to ask people, they're required, right? But the client may not know it's required. But you can tell them like, hey, I'm gonna have to do this assessment with you. I know some of these questions may be a little invasive. They may be a little kind of weird, but I have to ask them for you. You can blame it on HUD, blame it on like, oh, our funders make you ask this. Oh, we have to do this. And this is what it's for, right? Like that simple explanation there will make someone feel they'll feel so much more comfortable answering those questions, right? And then you have someone to blame it on. You say, oh, these are the questions that HUD makes us ask. Another thing too, and I think this is maybe less common now, but I still see a lot of programs and agencies that have this. As you all are doing your different types of initial intakes or assessments or outreach work, like really try and think about, are we asking something that we need? Are we requiring something that we need? Right? I've seen so many programs that have like, government government ID, government documentation requirements when they don't actually have to have it, right? That's a requirement that they added onto their program, but that was not required by any of their funders. And, as some of you who, work with people who are experiencing or have experienced homelessness, right? That like IDs are hard to get and you lose those, right? I don't even have my ID right now. I lost it like 2 weeks ago. I haven't bothered to get a new one. It is what it is. Everyone loses their ID. Everyone loses their documentation. And so when you think about what questions you're asking, what types of documentation are required, you should really consider, do we need this? And also, are we using it? Are we asking this and we think we need it? Are we asking this, but then we find that we're actually not using it, right? If you're not using it, consider removing it. If you don't need it, also consider removing it. Just things to think about. Let's see. I think other things I wanted to say real quick about other outreach things. I think sometimes you'll have to realize that, when you're asking some of these identity questions, right, how people identify on this intake form, like just that conversation in itself might be triggering for someone. And so someone, might be having an emotional reaction to the question you're asking, and you shouldn't take that, personally, right? Like there was a time when, we were doing, we had like our little van, we were outside of a bathhouse. It was like basically a sex club for men who were looking to have sex with other men. Right. And so we were doing, a screening there. I was asking these, assessment questions. One of our questions was sexual orientation. Right. And so I'm asking this person this question, and they're like, oh, I'm not gay. I'm not here to have sex with men. Okay. And he got like seemed very uncomfortable with that line of questioning. Right. And in my mind, I'm like, oh, okay, well, you're here at this club that's for this purpose. But who is it for me to say that this person is not heterosexual? I don't know. Maybe they really did, come in off the street and wanted to use this gym facility. I have no idea. And at the same time, not only do I have no idea, but this is a test of our initial kind of relationship, right? Because when I'm asking this person this question about their identity, this is potentially a very triggering topic for someone. This could be the reason, why this person lost their housing. And I'm asking them to talk with me, a stranger, about it. And so, I had to learn, like, don't take it seriously or don't take it personally, right? Like, whatever response this person gives me, accept it, go with it. If you say, okay, you're straight, that's great. Let me write that down. This is what I have. This is, what we talked about. These are the options you gave me. I'm just going to confirm these with you. Does this sound right? And then I confirmed all those options with that person. And, we documented it. We wrote it down. And that really helped me build a relationship with that person, right? Because then that person felt like they could trust me, right? That I would believe what they told me. And that was a really important relationship building exercise. Moving on, when we're going into enrollment, right? And so when you're doing enrollment, the environment, right, can be very important. And so especially if you're doing an assessment, especially if you're doing some kind of additional intake or something like that, try and find a way where you can ensure confidentiality, or you can make the client feel like they are in a private space, right, where they feel safe giving it. If you're talking with the client and they're kind of like looking all around and kind of like seeing, other people there, or trying to, avoid eye contact, that might be a sign to you that you need to find a different location where you're doing that enrollment or where you're doing that assessment, right? And remember, when we're talking about the gender option in HMIS, we're not asking about sex assigned at birth. It's asking about self-reported gender, their gender identity. If you have some kind of facility, when you're doing enrollment that's based on gender, right? So some places will have that, a lot of shelters have that. I think that's common. So equal access is really about client choice at the end of the day. So you can talk to someone and say, hey, these are the facilities we have. This is what we have. What would you feel comfortable with? What would you prefer? Would you prefer this option or this option? Because these are the options that we have, right? Equal access isn't saying you need to build a whole new facility. It's saying, like, work the best with what you have and try and make accommodations as you can. That's all it's saying. When you're talking about bed and unit assignment, right? That kind of same facility question or point is going to come into it too. And also something that's going to be really important when you're talking about these shared or congregate areas, right, is like thinking about how are you going to, or what kind of policies do you have that address different types of harassment, right? I think a lot of times people get kind of confused, or they're not quite sure how to deal with like harassment of trans and non-binary folks, and they're not quite sure how to deal with, this bathroom situation. What bathroom do we have someone use? But at the end of the day, your agency probably has, or you should have, right, have some kind of policy about how you deal with harassment. You're going to have some kind of policy on how you deal with sexual assault. You're going to have some kind of policy, on what does de-escalation look like? You have all of those policies at the end of the day, and your harassment policy is going to apply to everyone, right? Like, if someone is being harassed in some way, you follow the harassment policy. And so that same thing is going to carry through any of the clients that you work with. And ongoing services. What does equal access look like? And so again, equal access is really about, okay, this is what we have. This is what we can enroll you in. And based, on how you are self-reporting, how you are identifying yourself, this is what we get to put you in, right? And so one thing you'll want to do too, and one thing you kind of can do and work with, right? I think, we heard that people had questions about, post housing, how can you, connect someone to services, or, once you get someone in a unit, what can you do? Right. And, all of you, right, are in this lovely Bay Area where there are a lot of really great service providers who have these types of like community, group programs. They have different kind of like community-based or community building programs, right? Like at the community health center I used to work at, we had, these kind of community some of your agencies might have like a community advocate type of position. You might have like a peer liaison, they're called all different types of things. But often it's kind of a way for people of certain identities, right, to form like a little community and kind of get involved with some of the work that you're doing. So a lot of your community health agencies will probably have some kind of program like that. Your local kind of like LGBT center, different types of culturally specific organizations, a lot of times will have that type of programming. And so post housing, post getting someone into this unit, right? Like connecting people to those programs and to those communities can be a really important way that you help those clients build a network of friends, right? Build a support network. Because I think we all know, right? If someone has a support network that's very strong, they're able to maintain that housing that you just put them in way better, right? Than if they feel alone and if they feel isolated. Let's see. Are there any other questions here on any of what we just talked about? Actually, we have one more here. Talking about changing the culture at your agency. And so, kind of as I said before, right, we have our public little box folder, and within that box folder, we have a self-assessment for equal access. And in that self-assessment, it has a whole list of different things that your agency can kind of do or kind of think about doing, right? Related to all of these here. So changing the culture at your agency, right? Like part of this is a culture shift in how your agency engages in this work. And that culture shift can be done in a lot of ways and at a lot of levels too. That's kind of what we're saying here. But any questions about any of that before we go to our quick break here? I'm going to stop sharing here. And so I think maybe with that, let's take like a 5-minute break. Does that work for people? So we'll say like 2:19 we'll come back. Does that work? Okay. So come back at 2:19, do what you have to do.